Berlin palliative care murders, doctor sentenced to life for killing 15 patients.
Tonight's crime story comes from Berlin, Germany, where a 41-year-old doctor, identified under German privacy rules as Johannes M., has been sentenced to life in prison for murdering 15 palliative care patients. The Berlin court found that the doctor administered a lethal mixture of medications to patients between September 2021 and July 2024. Prosecutors said the victims were part of a home palliative care service and ranged in age from 25 to 94. The court also issued a finding of particularly severe guilt, effectively blocking parole and permanently barring him from practicing medicine. Authorities are still investigating dozens of additional suspicious deaths. This case is disturbing because of trust. Families trust doctors. Patients in palliative care are vulnerable, and when someone is already very ill, a sudden decline may not immediately look suspicious. That is why prosecutors had to show that these deaths were not natural, not accidental, and not medically authorized. They argued the doctor gave patients an anesthetic and a muscle relaxer that caused rapid respiratory arrest and death. Investigators first suspected him in 4 deaths. Then the case grew. That expansion is common in medical death investigations. Once one suspicious case is identified, investigators go backward. They review patient files. They compare medication use. They examine timing. They interview families. They look for unusual patterns around one provider. In this case, the charges expanded to 15 victims, and prosecutors say more suspicious deaths remain under review.
Why are healthcare serial killer cases difficult?
Because death is already expected in some settings. Investigators must prove the medical treatment caused death and that the provider acted intentionally.
First, several patient deaths raised suspicion. Second, investigators reviewed the doctor's treatment history. Third, prosecutors identified a pattern involving lethal drug mixtures. Fourth, the case expanded from 4 suspected deaths to 15 murder charges. Fifth, the doctor confessed to killing 12 patients, while claiming he meant to relieve suffering. Sixth, the court rejected that as a legal justification. Seventh, he was sentenced to life in prison. 1. Whether prosecutors file new indictments. 2. Whether the 76 additional suspicious deaths lead to more charges. 3. Whether families sue the care provider. 4. Whether Germany tightens oversight of home palliative care. 5. Whether the case becomes one of Europe's biggest medical murder investigations.
A Berlin doctor entrusted with end-of-life care has been sentenced to life for murdering 15 patients. The case now raises larger questions about medical trust, oversight, and how investigators detect murder when death initially looks like part of care.